Welcome to Get to the Root, the podcast that's redefining what health benefits should be. I'm your host, Dr. Erica Armstrong, founder and CEO of Root. Here we explore the category we've created, root cause health benefits, a smarter approach that uses advanced lab screening and functional medicine to reverse chronic conditions and lower healthcare costs. Each week, we sit down with forward-thinking employers, innovative brokers, and change makers who are transforming healthcare from the inside out. If you're ready to move beyond sick care and build a healthier future, you're in the right place. Let's get to the root. Hi, everyone. I'm your host, Dr. Erica Armstrong. Today's guest is someone who truly walks the walk when it comes to employee well-being. Bruce Tapp is the CEO of Fastco Industries, a manufacturing company that's not only known for its quality products that they ship all over the world, but also for the way they care for their people. In an industry where burnout, absenteeism, and rising health costs often go unaddressed, he's taken a radically different path, investing in proactive, root cause-based healthcare for his team. His commitment hasn't gone unnoticed. He recently received the Rosie Award for Innovation in Employee Health Benefits from Health Rosetta. And we're proud to be part of that journey as Root now provides functional medicine and advanced lab screening to his employees as a benefit. In this episode, we'll talk about what inspired him to rethink health benefits, what it takes to build a truly caring culture, and the results he's already seeing. Welcome, Bruce.
Thank you very much, and thank you for that introduction.
Of course. You've built a culture that genuinely cares about the health and well-being of your employees. What sparked that focus for you, and how has it shaped your leadership approach over the years?
Erica, it didn't happen overnight. Early in my career, I had the responsibility for benefit selections and management. And then for a period of about 3 or 4 years, I stepped away from it. I let my financial person handle the benefits and the benefit renewal. And then when that person left our company, I think around 2017, I decided that I was going to get involved in the benefits area again, at least on a short-term basis. And at that time, we had been on a fully funded plan, and we probably were in a fully funded plan for, I would say 16 to 17 years. And I was pretty much aware of how fully funded plans operated, especially when it came time to renew the plan. In fact, that was a lot of times the only real contact you had with the benefit plan was renewal. And typically the way that went is that your carrier would come to you with a double-digit increase. Sometimes you would get lucky and not have quite that much, but a lot of times it was double digits. And then you would spend all this time trying to figure out, well, what can I do to get that down a little bit? I can raise the co-pays. I can raise the deductibles. I can raise the co-insurance until you get something that you could stomach in terms of an increase. The problem with that, though, is that it seemed like your employees are always the one that kind of bore the brunt of it, because you could get it down to a cost that you could live with, but they always lost a lot. And to the extent that they got wage increases, a lot of times those wage increases might be wiped away by the increases they saw in their healthcare costs. When I came back into this benefits arena again, I wanted to try something new. And I asked the insurance advisor that I was using then what was new out there in the healthcare world. And he got me involved in something called a health insurance captive. And the particulars of the captive aren't so important, but I decided to go in that direction. And one of the things that you had to do to join a health insurance captive was you had to switch from a fully funded plan to a self-funded plan. And once we switched to a self-funded plan, the light went on, our focus changed, because then instead of just accepting increases from your carriers, you began to look at what your claims actually were, because one of the things about self-funding is that you actually see what you are spending money on. And this allows you to make decisions that theoretically can help you improve your spend and at the same time not hit your employees so hard in terms of what they had to contribute. So from that point on, we've really been focused on improving the quality and the cost of our benefit plan. Now, not everything we've tried has worked, but I think through this process, our organization has a real appetite for change and experimentation.
Yes. And I love the focus on your employees were truly the inspiration to make the changes because you wanted to offer them more without having to increase what they were paying. Bruce, you've been recognized nationally with the Rosie Award for Innovation in Employee Health Benefits. What does innovation in this space look like to you, and why did you feel it was time to take a new approach?
Through this process, we have really two important goals in the healthcare space. We want to always work on improving the benefits for employees with as little out-of-pocket costs as possible. But at the same time, we also want to control the overall spend of the plan. And a lot of people would say, well, that's not really possible, but it is. First off, healthcare is a very large spend. It's one of the largest spend that most employers have on their income statement. For us, it's probably our fourth largest spend because we're a manufacturer. So we have raw materials. We have a bunch of outside services that have to be performed in our products. And then we have our own wages. Healthcare is probably number four. For a lot of companies, it's probably number two after wages. And it's interesting that a lot of companies, they're very rigorous about managing so many of their expenses. But when it comes to healthcare, it seems like they just throw up their hands and wave the white flag, and they don't really do anything about it. And I think that's where innovation comes in. If you just accept the status quo, you're probably going to get run over. It will crush you. It's powerful, and it's very difficult to implement change. But the really wonderful, interesting thing is that there is a lot of help out there. There's a lot of people, there's a lot of company, there's a lot of organizations, a lot of pioneers who have done a lot of things when it comes to innovation. In a lot of cases, my approach to innovation is simply evaluating different programs, different ideas that are out there, and selecting one to focus on that I think will have maybe the biggest impact on my company. I'll give you a couple of examples of things we've done. A lot of people in the industry, they point out that our medical system is too fragmented and that our primary care is woefully inadequate. And so the idea of direct primary care has been developed over the last several years. And that's something that we brought to our company. We actually have a nurse practitioner-based primary care. We actually have someone that comes in 2 days a week. So they are able to meet our employees right at work. Another area that we've made a lot of progress is on our drug spend. And here, just finding out how the whole drug world works is important. I didn't know the kind of games that pharmaceutical benefit managers played before I got involved in this. But it's really important to have a pharmaceutical benefit manager or PBM that's a real partner with you. You want to make sure you have one that's transparent. That is to say, someone who is just charging you for the transaction of the drug, not marking the price up, or not putting drugs on your formulary that are very expensive and that have rebates, but then not making you aware of the rebates and pocketing the rebates themselves. Other thing that we have in our PBM space is that we're allowed to carve out our specialty drugs. And this means that we have a company that will try to source them through manufacturing assistance or patient assistance programs. And that's very cost effective. It doesn't cost the patient or the company anything if they're successful in doing that. And then if that doesn't work, they're able to source a lot of these drugs out of Canada or another foreign country at a considerable savings to both the patient and the plan. And then just one last point, when you're doing all this, it's really important to have a good insurance consultant that's working alongside you that aligns with your interests as opposed to other entities like the insurance company or the PBMs. You want an agent whose financial interest is not tied to like getting a premium increase. And fully funded plans, a lot of times, if your premiums go up 10 or 12%, your agent reaps a little bit of a benefit as a result of that. And I'm not saying that in some cases they don't deserve that. It's an example, I think, of a misaligned incentive. So that's just a couple of things we've done. But the point is that once you get the spirit for change and innovation, it is addictive.
It definitely is. I concur with that. You made so many helpful points there. I'm so glad that you called those different features out. And especially that you already had DPC on site before adding Root. That's a common question that we get, are we DPC? And well, we're direct care, but specialty care. And so we get referrals from primary doctors all the time to take on the chronic condition. We're chronic condition specialists. And so that tends to be about 75 to 90% of the cost a lot of the time when you add up specialists bounce around and medications piling up and those sorts of things. But what in particular, Bruce, when you decided to bring in Root as a partner, what stood out to you about our model and how did it align for what you wanted for your team?
I think we brought Root on. We'd been at this for a while, so it wasn't the first thing that we did. And frankly, if you would have come to me 7 or 8 years ago at the beginning of this journey, I probably would have been, I don't know if I would have been dismissive, but I probably wouldn't have really got it in the sense of understanding what it is that your team and you are trying to accomplish. As we went into this journey, we began to see things a little differently. And I think the biggest thing with Root Functional is we brought them on as a partner because I think your organization really sees the big picture. And you play, to use a sports analogy, you play the long game. You are working towards, and you have a plan in place and a structure in place that's working towards solutions that have lasting results. There's a book that I read a while back. It's by a medical doctor who became a medical journalist. At one time, she wrote in the New York Times. I'm not sure if she does that anymore, but her name is Elizabeth Rosenthal, and the book is entitled American Sickness. And it's really a pretty brutal and devastating critique of our healthcare system. And one of the interesting things in the book is that she has, towards the beginning of the book, she has what she calls, I think they're called 10 rules for a dysfunctional healthcare system. I thought a couple of them are interesting, but rule number 1 is, to quote her, she says, more treatment is always better and default to the most expensive options. And then rule 2, which I think is really significant in the conversation about Root, is, quote, a lifetime of treatment is preferable to a cure. And when I look at my population, and I'm sure that most employers are really in the same situation, you look at, for instance, the number of people that have, say, type 2 diabetes. This becomes really relevant. And the status quo really would prefer it that you just dealt with your type 2 diabetes patients by just getting them on the drugs and just spending that money every year and just managing it that way. And we all know, if you watch any television at all, that it's just inundated with the latest and greatest diabetes meds, for instance. And of course, there's examples from other chronic conditions, but diabetes is a big one. And they're constantly churning out new, and really, they're very expensive drugs to really entice unsuspecting patients, because I think there's a lot of people that battling their type 2 diabetes is a real issue. And so they're probably out there always looking for, hey, this particular drug doesn't seem to work. Maybe if I try this one. But in a lot of cases, what they don't really know is how much that drug actually costs. And there's never a hint. There's never even a suggestion in those ads. And even I think in probably a lot of medical circles that there might be a way for you to actually reverse your type 2 diabetes. And I think that's what drew Root Functional to me, at least. It's just made it logical because, you know, your methodology, you want to get to the cause, to the root cause. That's why you're called Root. And you actually want to work on solutions that actually reverse conditions so that in the long run, maybe someone can actually wean themselves off a medication altogether. But the idea is that, well, that's not going to happen in 1 month. That's not going to happen in 6 months. It's maybe not even going to happen in a year. It is a long-term commitment. In order to really be involved with your program, we can't just be, you have to focus on your costs every year, but you have to also take a longer approach. That's why I think Root was a very good selection for my company.
Thank you, Bruce. And I just want to reiterate a couple of your points that you made. One is that people get prescribed these medications and really they've never been told that there might be another way. So they are just doing what they have been told and taking the medicines. And it's disheartening that hasn't been another suggestion or often not even a visit with a nutritionist that has been done. The other thing that you mentioned from that book, I like how She calls it a rule of a dysfunctional health system, which is the opposite of functional health system, and that a lifetime of treatment is preferable to a cure. And that's exactly what you're talking about here. If we just keep people on the same meds and we don't look at another way of actually getting to the root cause and reversing insulin resistance, which is very possible, and we see it all the time. So, Bruce, we've been working together now for over 6 months. It's been an absolute pleasure, and I appreciate what you're saying about long-term health benefits that are clearly there, but we've had some really successful wins already, some in the first quarter and some in the first 6 months. What have you noticed about your team's response to Root so far?
We have had a number of cases of improvements. There's one that stands out to me of an employee who got involved with Root, and during the course of the blood work that you do, and I think sessions with the nutritionist and the doctor, they uncovered there were a number of food allergies, reaction to spices that the person had. This particular person, then they redid their whole diet, and they told me, I don't know, probably a month ago that, you know what, I feel so much better. I did not realize what it meant to feel good. Now, not everybody has had that sort of Damascus Road type of conversion, but there are several examples of people that have lost a good amount of weight from 10 to, I think, almost 40 pounds. And that is strictly by using some of the dietary recommendations because your program also is very big on food as medicine, and you have specific dietary recommendations, the Root plate, for instance. And then I've noticed also that there's been a lot of individuals that have had specific conditions uncovered that they were, through the care of their regular PCP and maybe even some specialists, just got under the radar. And I think one that is, somewhat common is Hashimoto's, which you know more about than I do. And in some of those cases, I'm pretty sure that the solutions are not fully developed yet, or the results aren't totally where they need to be, but the diagnoses are in, and treatment plans have been developed. So I know just in my own case, there are a couple of deficiencies that I had, vitamin D, which, having heard you speak many times, I know a great odds that probably 90% of any given population is probably low in vitamin D, but nevertheless, that does have some negative ramifications. And so I think almost everybody that is using the Root Functional Medicine in our company, I'm pretty sure most of them have probably addressed their vitamin D deficiency. So those are just the early results too, because we're just into our 7th month. And I'm pretty confident then when we hit that year threshold, we're going to see quite a few more. And I think at that point too, we'll be able to probably quantify it a little bit more precisely.
Yes, thank you, Bruce, for sharing those early results. And I think lots of different areas just for the audience to know what we help with. And Hashimoto's is the most common autoimmune condition. And then there's been some gut health, some improved presenteeism from people who are no longer sick and missing a lot of work. And then migraines are another area that we help in. And most medications can be pretty expensive too. And sometimes there are procedures and ER visits and specialist visits that go along with that condition.
I think too, just your root panel at your blood work is a little bit more comprehensive than what a typical person might get from their more conventional PCP. And I think that really helps to uncover things that might fly under the radar.
Yes, absolutely. Thank you for mentioning that. So Bruce, for other business leaders who are listening, who want to do more for their employees' health, but they're not sure where to start, what advice would you give them?
I think the first thing, if you're at least an employer with about 50 employees, in my opinion, you really should consider self-funding. And if you're larger than that, you should definitely consider self-funding, because that's really the only way to get a handle on your medical spend and where your money is going. Find out what your biggest spends are, and then implement solutions that are designed to address those problems. If you have a high spend on diabetes medication, for instance, a short-term solution, you should be looking at your PBM and just making sure that you are paying a fair price for your diabetes meds. But then, in my opinion, you should also consider a more long-term solution like Root Functional, which is designed to actually reverse that disease condition. For every problem you have in your population, there is, I think, a potential mitigation strategy. Nothing's perfect. Nothing's going to stop you from dying at some point. And not every condition that someone comes up is reversible. But I think most situations can be improved. And the point is that there are options out there. You don't simply have to accept the status quo. If you're on a fully funded plan, you don't really get to look at what your claims data is. So you're really out there flying blind. And when you get a big increase from year to year with very little explanation as to why you're getting that increase, you really don't have a whole lot of options. Now, some people think, I just don't want to think about it. I'll just bite the bullet at renewal time. I don't know if that's a real smart strategy long term. Ignorance is bliss, but it can be really expensive if you're not paying attention.
It's clear to everyone at Root how much your team and your leadership cares about their employees. And it was the reason behind your strategy to give them the best health benefits that you could find. We really appreciate working with you, appreciate having you on the podcast. If other companies are listening and you're interested in exploring Root health benefits and how that can integrate into your existing benefits, you can head to our website, rootfunctionalmedicine.com/4companies. Thanks for listening to Get to the Root. If you enjoyed today's episode, be sure to subscribe and share it with someone who's ready to rethink healthcare. You can learn more about Root Functional Medicine and our work with employers at rootfunctionalmedicine.com. We'll see you next time, where we'll keep challenging the status quo and getting to the root of what really drives better health.